Excellencies, ladies and gentlemen, with just under 500 days left to achieve the Millennium Development Goals, we must all step up our efforts to reach our targets, especially those aimed at reducing maternal deaths and achieving universal access to reproductive health services, MDG 5A and B. I commend the bold leadership of the First Lady of Kenya, the Ministry of Health, and the Council of Governors to accelerate action on MDG 5A and B in this final stretch of our MDG marathon. As a physician and a former Minister of Health, I know that only a broad-based effort mobilizing a wide range of partners across sectors and national, county, and local levels can tackle the scale and burden of maternal and child deaths in Kenya. That's why it is so important that we have brought together your leaders, you as leaders, political drivers and thinkers today, to collectively reflect on progress and deliberate on challenges. The Beyond Zero campaign is about saving the lives of mothers and children and the leadership of county governors, which is extremely essential. Your work together with the UN family, especially UNFPA, the World Bank Group, USAID, DFID, and other development partners is exactly the kind of robust collaboration needed to tangibly improve the lives of families and the communities in which they live. In Kenya, approximately 6,000 women die each year in pregnancy and childbirth, nearly all of them in just 15 of 47 Kenyan counties. I appeal to all the honorable governors to mark your legacy by translating your Beyond Zero pledges into concrete results for women and children. No woman should die giving life. We know what to do. We know how to do it. We know where to do it. And we know how much it will cost to prevent these needless tragedies. At UNFPA, we are committed to meeting countries' family planning, health, and reproductive health needs. We're investing in health workers with midwifery skills and ensuring access to emergency obstetric care when complications are anticipated or when they arise. Adolescent girls are particularly at risk of dying in pregnancy and childbirth, yet too often they face barriers to life-saving information and services. Worldwide, 70,000 teenage girls die in pregnancy and childbirth every year, making maternal death the most common cause of death in girls between the ages of 15 and 19 years of age. Married too young and pregnant too soon, many adolescent girls are denied the chance to fulfill their potential. But if we can keep them in school, enable them to delay marriage and pregnancy, empower them with choices and a voice in decisions affecting themselves, they will transform their families and communities and contribute to the economic development of their societies. Political will is key, and I wish at this point to commend the government of Kenya for adopting its free maternity service policy and allocating 4 billion Kenyan shillings towards maternal health in the current 2014-2015 budget. Your leadership and action can ensure that health centers are equipped with essential life-saving drugs and supplies, skilled health workers are available at all levels, and a functional referral system is in place. In just a few weeks, world leaders would meet at a special session of the United Nations General Assembly to review 20 years of the implementation of the 1994 International Conference on Population and Development Plan agenda, and we're expecting a strong Kenyan delegation. One of the lessons we have learned over the past 2 decades is that investing in universal sexual and reproductive health and ensuring that women and girls can exercise their rights is an investment in peace, security, and sustainable development. Let me wish you much success in your meeting today, and I want to reiterate the UNFPA's strong commitment to working side by side with you to ensure that no woman should die given life. I thank you.